real steps regarding increasing the number of appointments to see GPs, and certainly a significant increase from pre-pandemic levels. And also a lot of those appointments have been face-to-face for patients as well. There's been quite a shift for quite a few practices, a lot of practices, around making sure that the patient's seen by the right person, and this has included drawing in a lot of the allied health professionals such as Pharmacy First and physicians associates and other members of the general practice team to really make that access better for patients so that they're seen by the right person at the right time.
We piloted an alternative approach to urgent dental care for patients who did not have access to an NHS dentist. Over a 5-month period, we provided an additional 106 clinical sessions for 514 patients with the most complex urgent care needs. We know there is still further work to do to improve NHS dental access for people living in Sussex. We continue to collaborate with the dental profession and use patient insight to enhance and transform the way we deliver dental care.
Partnered with the British Red Cross to establish the High Intensity User Service in the Brighton area. This service supports patients with many needs. These patients will call for an ambulance or come into our emergency departments, sometimes multiple times a week. The British Red Cross work with 999 and our emergency department to identify and work with these patients. They work on resilience, self-confidence, look at the services that are available to these patients in the community and look at unblocking the reasons why they're not accessing them. In the last year alone, the British Red Cross worked with 65 patients. This doesn't sound like a huge number, but for the system saved hundreds of calls to 999 and hundreds of presentations into the emergency department. More importantly, it means that these patients are getting the right support in the right place at the right time.
It's great to reflect back and consider what the All Age Continuing Care teams have achieved across Sussex, serving some of our most complex patient groups and also ensuring that over 3,000 patients at the end of their lives receive the care that they need.
This is tremendous. I mean, I was so fortunate to get the appointment today. It was like, you know, like that. Straight in, it's a wonderful facility. It's really beautiful.
I had a conversation with a lovely nurse on the phone, and then I came today, and then I was put into a CT scan, which was 3 minutes. It was very quick, very painless. It's a free service, and I think it's very good.
So kind of embedding the culture of like that mental health is important in this school and kind of helping them to facilitate that and lead it themselves. This hopefully kind of equips young people as well for kind of future difficulties that they may face.
I have a diagnosis of autism, yes, and ADHD. Well, when I found out, I thought my life was going to be over. So now I'm pretty happy about it because I know that there's a lot of other people in the school that are like me.
Having a real focus on health inequalities and actually understanding where they exist. So that's been through looking at our data in a lot more detail, but also speaking with communities directly. I'm really pleased that in Sussex we yet again have increased the number of annual health checks that have been completed in primary care for people with a learning disability. This is a fantastic opportunity for those with a learning disability to come into primary care when they're not poorly and not unwell, but actually then to have the time and the opportunity to consider if they have any unmet health needs.
It's to make sure you've got a good bit of health.
Yeah.
And give you an MOT.
Yeah, that's right. We have a great relationship. Oh, and it all started with having a proper health review.
I can open up to her because we've got to know one another.
It is an interesting time, and over the last year we've been able to define our target operating model, and we're now looking to redefine ourselves as a strategic commissioner, and I look forward to now starting the work around implementing that.
We're an organisation of many great individuals, and we've come a very long way in the last 12 months.
Yes, and so proud to be working for NHS Sussex. 23-24 has been a hugely challenging year, but with huge rewards, and I think where that's left me and where that's left the organisation is an absolute appetite and commitment to doing the very best we can for our local population moving forward.